What is the benefits for bone density? It has been shown to be particularly effective for postmenopausal women, older adults, and those at risk for osteoporosis or osteopenia. And weighted vest walking provides a vertical load. Because we're standing, we're putting that pressure axial down onto our spine. And so it's especially beneficial for the femoral neck. So think of the long bone in our thigh, the neck that connects into our hip. So it's going to be... A lot
of the times when people have hip fractures, you're actually fracturing this femoral neck.
So it's going to be really beneficial to help provide that load and that added pressure to help with bone density and just the lumbar spine, because again, we're now standing vertically and we're putting that pressure down into the spine. So those are two really critical fracture sites. So that's why I believe that this has taken such a hit on social media. Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
Doctors of Physical Therapy, coming back to you with another episode, this time on weighted vests.
Hot topic.
I feel like this has been a very popular trend, and so we want to break down the research for you, understanding, is this just a fad? Is this something that you need? Should you be doing it? Let's dive into the research. But of course, before, I want to hear in the comments, have you been doing this? Did you buy a weighted vest? How have you been feeling? Let us know. And also don't forget to subscribe to hear so many other topics and just movement related videos.
All right, hot topic alert. This week we are talking about weighted vests and weighted vest walking specifically. Is this just a fad, or is this actually a fitness game changer that you can add into your routine? I got to credit ChatGPT for giving me that line. Is it a fad or is it a fitness game changer? Yeah, so many people I feel like are adding this in and saying, oh, this is amazing. And we just wanted to look a little bit into what research there is behind weighted vest walking and if people should actually be thinking about adding it in.
Yeah, and I think it's a cool conversation that it's going around because it's in relation, particularly, the reason I feel like it's been popularized, and maybe I'm seeing it a little bit more, is because it's been very popular in the perimenopause, post-menopause conversation of how do I help to improve my bone density? Because unfortunately, we don't really know what our bone density is unless we go get it directly tested.
Get the scans.
Right? Or we fall and fracture something.
Yeah.
So I do love that this conversation about how do we maximize our bone health is so popular right now. But we just want to help you understand, is this something that you should be jumping on? How often should you be adding it in? Like, what is the protocol? And what is most important when it comes to bone density health?
And I think there's a few different reasons as to why it's becoming popular or why it might be catching on. It's pretty simple and pretty accessible. And a lot of people already walk. And so if you're already walking, is there something that I can do that's going to maybe increase the calorie expenditure? And if there is bone density improvements, great. Why don't I just add a weighted vest on if I'm already going on walks consistently throughout the week? There's a focus on longevity, and it's a low impact exercise. So people who might not be able to run anymore, this can be more attractive to. Rucking. There's a population who likes rucking, which is essentially wearing weighted backpacks. And there's a reason that wearing a weighted vest might be more comfortable. Wearing, the weight just in a backpack on your back might have different postural changes in how you're walking. And the fact that Jen just brought up, weighted vests have become a rising trend among the menopausal and perimenopausal population, hopefully addressing challenges that people going through menopause face, like bone loss, heart disease, and metabolic changes in their body. Right
off the bat, we do understand, and I think it's important to bring up that walking with a weighted vest, when you're walking, so you're doing movement, and now you're going to add some load to that movement. So wearing a weighted vest, that's 10 to 15% of your body weight, can actually increase calorie burn by about 12 to 15% compared to unweighted walking. So,
which makes sense. You increase the weight 10 to 15%, you increase the calorie burn 12 to 15%.
Right. Now, I have also looked into things where it's like, well, walking, probably not too bad to add 10% of your body weight. But if you haven't really been doing anything, maybe that is where you want to start with, like 5% of your body weight.
Yeah, start a little lower. And that's also where there could be unseen compensations. If you're not on a treadmill and also tracking the speed, or if you're not using an app that tracks like how far you've gone and how long it takes, you might just be walking slower. Mm-hmm. And that then can kind of compensate for the weight that is giving you an increased calorie burn, could then, come down if you're walking slower because you have extra weight. So like Jen said, if you start lower, 4 or 5% of your body weight, that could be more appropriate. And if you have some sort of walking app that helps you know, okay, I'm keeping the same kind of pace that I normally do, that's when you'll maybe see this benefit in increased calorie burn.
Yeah. And then starting to progress it based on how you're feeling and how you're doing. Like everything should be gradually progressed, right? It's the same with like going into strength training. We're not just going to put a heavy barbell on your back. We're going to say, oh, maybe start with some dumbbells or resistance bands and then build it up from there. So it's the same. I just want to put that out there. Same with weighted walking. Now, when it comes to bone density, so what is the benefits for bone density? It has been shown to be particularly effective for post-menopausal women, older adults, and those at risk for osteoporosis or osteopenia. And weighted vest walking provides a vertical load. Because we're standing, we're putting that pressure axial down onto our spine. And so it's especially beneficial for the femoral neck. So think of the long bone in our thigh, the neck that connects into our hip. So it's going to be...
A lot of the times when people have hip fractures, you're actually fracturing this femoral neck.
Yes. So it's going to be really beneficial to help provide that load and that added pressure to help with bone density, and just the lumbar spine, because again, we're now standing vertically and we're putting that pressure down into the spine. So those are two really critical fracture sites. So that's why I believe that this has taken such a hit on social media.
Yeah. And we were a little more interested in okay, well, how long does it take to see changes in bone density? And the one study that came up was actually done all the way back in 2000 that showed significant improvements in hip bone density after 9 months of walking with a weighted vest. The protocol they used was walking 3 days a week, 45 to 60 minute sessions for 32 to 36 weeks. And the vests were anywhere from 4% to 10% of somebody's body weight. So you could expect to, if you do this for 9 months, see some of that bone density improvement.
But I think that's so crucial too. It's the consistency of it. Right? Yeah, it was 3 days a week, but it was 45 to 60 minutes. So you're walking for almost an hour every time. And you're doing it for 32 to 36 weeks.
Yeah.
And I think that's what's so crucial and what people forget. It's like the benefit isn't going to come within a month, within 6 months. Like it takes time.
Which is also where if you're trying to start this habit and you're like, okay, I need to start weighted vest walking, and you just hate it.
Yeah.
Would we recommend that to somebody who just hates walking in general or hates, weighted walking? I think there might be other exercise options for you that could help you see the same bone density increases that you might enjoy more.
Right.
And so that's another thing that you need to weigh. We also wanted to see if there was any research out there that compared this to other methods of training that have been known to increase bone density, like strength training. Mm-hmm. We found articles, we didn't find specific randomized controlled research studies that compared these two things to each other. Some articles that we found said strength training is still more efficient per minute for improving bone density, especially at high loads, low reps. I would believe that. I don't think that, like I said, there's a randomized controlled trial that is directly comparing both of those things.
We need more research.
And that's where we always need more research.
Especially for women.
But then on the flip side, it said, however, weighted vest walking is more accessible and still provides site-specific benefits to the hip and the lumbar spine, which are two common, fracture sites. And then the last point was combination programs of strength training plus weighted vest walking would be more effective, which again makes sense, but I would love to see a trial that compares weighted vest walking, strength training, and a combination program over 9 months and see what it says.
Exactly. That would be really, really interesting. So we're still waiting on more data to really see. And this is where I saw one of our physical therapy friends. She actually put a post about talking about it. She's in the perimenopause state. And so herself was like, okay, let me see how it benefits my body. And so she started doing this herself just to be N=1 person to kind of, understand her own experience. And she said, it's good. But if I'm going to tell someone to buy a weighted vest and do this consistently and all this stuff, and where you're going to want to put your time if you haven't been doing anything is going to be into strength training. She said, I'm going to want you to put some resistance and some load onto your body and really maximize your strength training benefits and start to progress there prior to worrying about, weighted vest walking and if you should invest in this and what that means and what that looks like. She said, I believe the biggest bang for your buck is going to be strength training.
I would definitely put my money behind that being more effective if we did a direct research comparison. And if you're someone that can tolerate any sort of higher impact jumping style workouts, hit type workouts, I would think that might yield a little bit higher results, again, with the same consistency and over the same amount of time.
Which we did a previous podcast episode on osteoporosis and osteopenia. And we talked about some of those protocols and what those entail. So I would go back and listen to those. But again, like Dom had said before, if you're already walking and this isn't going to add too much, to purchase this, then
throw on a weighted vest.
But still make sure you're strength training.
Go wild. Another one of the purported benefits is cardiovascular health. And kind of how we mentioned before, if you're going the same distance at the same speed and you put on a weight vest between 10 and 15% of your weight, you could see an increase of 12 to 15% of calorie expenditure. How does that compare to other options that you could do during walking? One of them is running. Running is hard to measure what the increase in calorie burn is because there's a variety of different speeds, everything, that goes into that, a lot of variables. So the calorie burn, it was just reported as higher than using a weighted vest during walking. Incline walking, about the same. So if you're going to go for a hike, you see about a 13% increase in calorie burn. Again, that's very dependent on the grade of the incline and the speed that you're going at. Rucking, like I said, using a backpack or a weighted backpack, about the same 10 to 15% increase in calorie burn. And then strength training, again, very variable on what you would see in the percent increase in calorie burn. I don't know if they're comparing this to walking for 30 minutes and doing 30 minutes of strength training or what the comparison was there. But then again, each of those come with a different bone density benefit and accessibility. Like running is not accessible to everyone, especially if you're getting into that perimenopause phase. You might have some issues getting just jumping right into running, and same with weight training or strength training. You might not have the equipment, you might not have the access. So the highest accessibility is walking with a weighted vest or incline walking, at least of the ones that they reviewed in that article.
But the biggest bone density, the highest impact for bone density is going to be strength training.
Yeah, would be strength training.
So again, something to take into consideration.
But that was in the cardiovascular section, so.
Now, when it comes to, understanding the risks and the safety considerations, this is where we go back to start light. 5 to 10% of your body weight. You don't need to go to 10 to 15% of your body weight right away. I think that's too aggressive. You're already walking, so you're already putting some impact into your body. So just starting with a lighter load can help. You just want to be really cognizant if you're already having balance issues, you're already having a lot of pain in your joints, or you recently had an injury. We then want to say, okay, maybe we don't start it yet. Maybe we're working on some of these other balance and strength issues where, again, going back into the gym, getting some strength training. Strength training is going to improve your balance because so many exercises we do on a single leg or a split stance. And so you automatically are working on balance in those areas as well. And then just making sure that you're getting one that fits better for your body. Like some people like it strapped under the bust. Some people like it strapped on over the bust. So kind of feeling what feels best and most appropriate for your body where you're not impacting your posture or your movement. We need our upper thoracic body to move, our upper spine to move as we walk. So we just don't want to be stiff up there. And then making sure that we're starting kind of on a flatter ground rather than jumping right to like hills and inclines.
Definitely. And practical tips to incorporate this. Like I said, if you're already going on walks, you're probably already conditioned for the walk that you're doing. An increase of 10% is generally okay. So yeah, if you start somewhere in that 5 to 10% range of a weighted vest, you'll probably do okay with it. You might feel a little more sore. You might notice a little more exhaustion than you normally would during that walk. But if you are doing this, start with 2 to 3 walks a week, 20 to 30 minutes, and build up from there.
Yeah.
Like we said from the study earlier, it was 3 times a week for 45 to 60 minutes. Yeah. So if that's your goal, like work up slowly without noticing burnout, without noticing an increase in fatigue from week to week, slowly work up to that 3 days a week, 45 to 60 minute sessions. You can stack with other habits, walking a dog, listening to your podcasts, even running errands, it says here. So I don't know if that means putting on your weighted vest and heading to the grocery store if you're going to be walking around for 30 minutes at the grocery store.
Maybe it's going to become a fad that people are doing.
Everyone just wears. I've seen, when we were doing this, I saw some weighted vest ads pop up because I was searching weighted vests.
Yeah.
And there are some that literally look like a vest you would wear out. And I'm like, wow, okay.
That's hilarious.
Yeah. And the last practical tip, consider combining with 2 strength sessions per week for the best results, because we know that you get good bone density results from strength training in general. So as Jen mentioned, our PT colleague also said, that's probably where you're going to get the best bang for your buck. And strength training also has incredible cardiovascular benefits, especially if you're going heavy. And going heavy is when you're going to get the best bone density benefits as well.
Yeah, especially when we're talking about metabolically for the body and all these hormonal changes that you're experiencing. We're going to want to go heavy. Strength training is so key and so crucial. So I would say that, this weighted vest walking can be a great supplement to strength training. But if you haven't started strength training yet, I would begin there and then think about adding this as your supplement to just help with bone density and all the other incredible things that it does for the body. But and walking is great. We love walking. I want to do walking more. I keep telling myself every day I'm going to do more
every day.
Yeah. So
Twice a week,
there's
3 times a
so
week.
many benefits to just getting out and walking in general.
Yeah.
Adding a weighted vest can be a great option if you're already doing it. But again, to supplement to strength training, start there.
Thanks so much for tuning in on this conversation on the hot topic, weighted vest walking. Is it beneficial? Should you be adding it in? What did you think? Are you someone who already does weighted vest walking? Do you go on walks in general? And would you consider throwing on a weighted vest after hearing this? Please comment down below. Let us know if there are other topics that you want us to cover, because we do one of these podcasts every other week. It's coming out on YouTube. Make sure to hit the subscribe button and notification bell so you don't miss out on any in the future.